We have been involved in a number of clinical research studies, multi-institutional clinical research studies, particularly those around pulmonary disorders. So recently we have joined another multi-institutional study called the TOLSURF study, and actually one of our faculty members, Dr. Bill Trogue, is one of the leaders in that investigation. This study involves the trial of using surfactant later than it normally is used. And I should say surfactant, as most people know, is has been the best studied medication that we've had in neonatology. There have been multiple randomized studies looking at surfactant, but all of those studies were done with surfactant being given within the first minutes or hours of life, or certainly within the first 2 days of life. The idea being that an infant is born preterm with insufficient surfactant, and if you instill that surfactant, you correct the problem and the baby then will do fine. But the reality is, particularly for extremely preterm babies, although they get surfactant at birth, they don't get fine. They aren't all better, and 3 or 4 days later, some of those babies have actually an increase in their ventilatory needs. Their oxygen needs go up, and so on day 3, 4, 5, they actually seem to be getting sicker, maybe having gotten a little better in the first couple of days, and so they have kind of a downswing again. And so the theory is that those babies probably continue to have insufficient surfactant production or have some inflammatory changes that may block the surfactant that they do have. And so the idea in this study is to provide surfactant later in the course of the disease, not just at the beginning, but again repetitively throughout the first weeks of life, to see if you can alter the course of chronic lung disease. And so it was natural that we would be part of that study, because we've been a part of a number of studies looking at therapies for chronic lung disease, and that's a focus of what we do at our nursery.